Hey, good morning, everyone, or good afternoon, wherever you are in the world. My name is Dr. Anna Fitch-Corey, and I'm the Director for First Responder Health and Wellness with FirstNet, built by AT&T. Today, I'm going to provide an educational session on the health and wellness strategy, why we're doing it, and how the program will help direct efforts in the future to support law enforcement health and wellness. The learning objectives that I'll cover during this presentation are outlined here. I'll start with a brief history of FirstNet, then describe the vision of the FirstNet Health and Wellness Coalition, how it became a concept for the organization, review the theoretical basis and conceptual models, and then describe the goals, outcomes, and where we are in the process. First, let me tell you a little bit about the history of FirstNet. So after 9/11, the US government realized there were serious communication infrastructure issues. The ability of public safety and response individuals to communicate was compromised by higher than normal use from commercial customers during the critical events. This created dropped calls, lag time, communication issues that inhibited public safety from doing its job effectively and efficiently to save the lives and respond. So an assessment of that infrastructure, as well as the input of many public safety officials, led Congress to issue a mandate for a nationwide wireless broadband network built specifically for public safety. Congress created the First Responder Network Authority and charged it with delivering this network. That's what's called the FirstNet. And in 2017, AT&T was awarded the contract to build and maintain FirstNet. As of first quarter, we have more than 16,000 agencies and organizations accounting for more than 2 million connections that have joined FirstNet. This is a historic example of how a public-private partnership can achieve a communications infrastructure that improves how we respond to public safety events. So what does telecommunications and for first responders have to do with public health? We'll discuss that next as I describe how AT&T went from building out this public safety network to really seeing the importance of health and wellness of first responders as a part of this mission. The FirstNet Health and Wellness is built on the socio-ecological model of health promotion and public health. We know as public health practitioners that health can be influenced at many different levels. Traditionally, and what most people are familiar, is the individual and family levels in which we actively engage in addressing health risk factors of that specific population. We know as public health practitioners that health can be influenced at other levels as well. We know that communities and organizations have a role in public health, and we know that there's an opportunity to influence health at the federal and national level. When I began building out this program, it was important to me that AT&T understood that they were influencing the health of first responders and law enforcement at the organizational level. This meant that as a corporation, we saw an opportunity to use our existing capabilities, our influence, our corporate relationships, as well as our financial abilities to support the health and wellness of law enforcement officers. I was very clear that we would not actually be delivering healthcare services because we are not a healthcare organization. This is a critical distinction to make because it drives the strategy of how and what we can do. Consequently, as the FirstNet Health and Wellness program was conceptualized, it began with the question, what can AT&T do as a telecommunications corporation to support the health and wellness of public safety as one of our chief customers? From that question, we began to build our vision from our corporate value statement. Visioning drives public health programs from where they are to where they want to be. Consequently, visioning needs to be built on the foundation of a corporate or an organizational value system. The FirstNet Health and Wellness program is built on the foundation of AT&T's corporate value of Be There. At the heart of Be There is the FirstNet programs and AT&T's commitment to caring for its people, its customers, and its communities. It asks us as an organization, how do we show up and support the health and wellness of first responders? And I believe this strategy provides the opportunity for us to demonstrate caring for first responders the whole first responder family while facilitating communication, connections, and community, something we're really good at AT&T, as well as developing programs and processes that enhance the health and wellness of the specific population. So we also want to emphasize that the FirstNet Health and Wellness is not about being a sales tool, because we actually have no contractual obligation to do this. It really is based in and nested in who we are, what we believe in, and how we live out those corporate values for one of our primary customer bases, which is law enforcement. Our FirstNet commitment isn't just about delivering that wireless broadband capability, even though it's really incredible and beautiful. It's also about like how we care about their customers, how we've identified that law enforcement sees their health and wellness as really a priority for them, and how we step up and become a part of that dialogue. So when we became a part of the public safety community, it meant for us that we take care of our people, just like we would do at AT&T corporate. First responder health and wellness is all about taking care of the people that keep us safe. And it's our opportunity to jump in and be a part of creating solutions. Because we know that when law enforcement is healthy, well, ready, and resilient, they're better able to do their jobs and be more successful at their mission. Consequently, they're also going to be better and more successful in utilizing the FirstNet infrastructure in responding to critical public safety events. So our vision was really derived from that corporate statement. It's first and foremost to be there for first responder health and wellness and their families. Our mission is to integrate responder, community, industry, and academic capabilities to support the health, wellness, and readiness of American first responders. We believe that this integration of multidisciplinary organizations towards a common goal will help us achieve that strategic aim of the healthy, well, and resilient first responder that are ready to support public safety at a moment's notice. However, before we could identify what we can do to enhance their health and wellness, we really needed to understand what was threatening their health. And this kind of led us to the literature and a survey tool to assess the population in of itself. So what do we know? And some of these are probably not going to be unfamiliar to you. We know that across professions that fall into the domain of first responder, there are common themes and risk factors. The literature indicates critical issues facing first responders, of which police and law enforcement are those. Post-traumatic stress disorder, acute stress disorder, depression, anxiety, suicidal ideation. This slide demonstrates the top 3 health risks to first responders discipline identified. We know that there's similar threats to those who serve and support service capacity to public safety. Those are individuals that are your embedded psychological services, social work, public utilities, etc. We call those extended primary support services. We know as a result of these top risk factors that there are also secondary and tertiary health risks, including the impact of shift work, drug and alcohol abuse, musculoskeletal trauma, hearing loss, obesity, heart disease, cancer, metabolic syndrome, and others. The rates of PTSD, depression, and suicide among these groups is greater than the general population. PTSD, for example, is almost 5 times more prevalent in police officers than in their counterparts in the community. First responder longevity is greatly impacted by these risk factors. We know that these health issues impact first responders across all disciplines. And we know that these health issues impact readiness. So readiness is defined as the mental, physical, spiritual, emotional ability to be ready to respond to the demands of one's job at a moment's notice. So consequently, we can see from the literature that health and wellness is critical to the ability of first responders to be able to do their jobs. FirstNet is not just about that wireless broadband network. It's also about those people that use the network. And so what I told our leadership was we could build all the communications, all the network connections that we were able to, but actually without those healthy and well first responders able to do their job, that network was not going to be effective. And so they kind of reemphasized our need to engage in the health and wellness of first responders as a part of that mission. So we started diving into some numbers as a part of our organization. We have a corporate social responsibility team who asked the general population what they saw as first responders facing significant mental, physical, and spiritual burdens from their jobs. And this was just to understand if the communities at large also saw the impacts that we were seeing in the literature from their perspective. And they do. 70% of our respondees think that first responders frequently face burdens from their job. And this is important because our communities are seeing the impact of the work that law enforcement and others are doing in their at the local level. And we knew that there was a problem, and we knew that the general population was seeing that there was an issue for first responders, but it really didn't answer the question for the organization if the general population could also see FirstNet as a part of that solution. So what we asked next as a part of this specific survey set was, do you see a place for FirstNet in addressing first responder health and wellness needs? And it did. The majority of the community responders to this survey said that although AT&T is primarily a telecommunications organization, there was a place for us to support this as our customer base, and that it meant a great deal to them. So thus far, we've learned from the literature that there are many problems that face first responders and law enforcement. There's a need to engage in responder health and wellness. And it's very important before driving into a plan of action. This is my perspective as a health and wellness professional, is that we also ask that population, law enforcement, fire, EMS, so on and so forth, what they think are their top health and wellness needs. So consequently, this led us to deploy the first responder needs assessment in order to systematically identify priorities for our health and wellness coalition by asking first responders about their health and wellness needs. Needs assessments kind of provide that color and context to the health and wellness journey that are facing these individuals, and really clues us into what are the actions they're willing to take as individuals as we engage them in their health and wellness. So the needs assessment collected a total of 475 total responses. 100% of the respondees agreed to complete the survey, although there were only 368 complete data sets. Of that 368, there was a fair distribution across the different first responder professions. 35% were firefighters, 22% were police, 16% represented emergency communications officials and emergency call takers, 14% were emergency managers, 5% were EMTs, 1% were ER docs and nurses as frontline medical, and the 5% reported being from the other category. Of those who responded, they were mostly male, Caucasian, and married. There was a slightly more even distribution across the ages and education demographics, with about 35% as the largest category being ages 45 to 54, and 36% of them had a bachelor's degree. I do know that in future iterations of this survey, I would like to have a higher response rate for my minority colleagues to ensure we capture a better representative picture from across all demographic sectors. That was one of the biggest weaknesses from this survey itself. However, I think that the data will still demonstrate a strong voice for health and wellness needs, and we're going to cover that next in the next set of slides. So the first question that we asked were, what are the top 3 problems that you felt public safety was facing right now in today's day and age? In this slide, you will see a list of the choices available and the percentage of respondents who chose those topics. However, the top 4 issues collectively were PTSD, depression, access to mental health care, and drug and alcohol abuse. And again, this is very representative of what we see in the literature. And I feel that that's great. I think that's important because it says that they are also seeing these issues in their personal lives, not just that scientists are telling them that this is a problem. So they see it from a personal perspective. So next, we asked the respondents if someone were to offer a free program to improve first responder health, which of the following would be of greatest impact? Again, you see the list of options that they had. There was also a free text capability in each of these questions. But the top 4 collective options were stress management programs, physical fitness training, wellness and life coaching, and resilience training. Next, I wanted to explore if there were any barriers that were going to that we were going to need to take into consideration as we were building out the FirstNet Health and Wellness Program. And so we next asked them, what are the top 3 things that prevent first responders from participating in activities that enhance their health? And the top 4 responses that you see here are not enough time, work-life balance, the cost of activities, and lack of awareness. These answers are actually very consistent with what we would hear from many different populations, because these are engagement barriers when we're trying to get people to be involved in their health and wellness. So when we get to the stage of developing our action plans for how we're going to address this as an organization, we really want to be taking into consideration these barriers so we can help the specific population overcome them as we move forward. So next, we asked the respondents, what did they think was the most valuable way to engage first responders in their health and wellness? So we've kind of gotten into what are the problems, what do they want, what are their barriers? This is the means of the survey. How do they want to engage in it? And honestly, these responses kind of surprised me. It was not what I was expecting from iterations of similar surveys that I've worked on in the past. This was, so first and foremost, the respondents overwhelmingly indicated that the most valuable way to engage their responders in health and wellness was to have their leadership engage and emphasize wellness in their departments. This is consistent with the literature, but it's surprising that the population responded this way. They also remarked that awards and incentives, amplification and awareness of programs, and for wellness programs to have standards to meet their first responder needs. I think these are incredible, rich responses from our survey individuals, primarily because I know from my experience from working with the US Army that when we had engaged leadership, those younger and more subordinate members of the population were far more likely to engage in health and wellness activities themselves. And for these responders to also be saying we want our leadership to walk the walk and not just talk the talk is indicative of bringing that community together, starting from the very top and laying out what wellness looks like in these individual departments. So finally, we did ask an open-ended qualitative response question that said, are there any other health and wellness needs, programs, services, issues that you would like for this survey to consider? And this question garnered 222 full text responses. And what you see here is just a word cloud of the most frequently used descriptions that first responders and program needs. And some of the most significant responses include the following comments. Health and wellness programs have a certain stigma. This needs to be overcome through training, focused programs, and support from leadership. Again, leadership came up in this dialogue quite a bit. Another person said, we need to normalize the conversation about common symptoms of PTSD and chronic PTSD. Let's provide training opportunities and mental health best practices, trauma-informed care, and resiliency education. Many individuals commented about integrated training in that department versus sending the responders outside of their organization. And they also mentioned incentivizing participation. Many addressed the need to cover sleep issues, family member engagement, and offering holistic programs, not just a flavor of the month sort of topics. They really wanted a comprehensive, well-developed, meet standards of a wellness program. And I thought it was very informative that they had this input in what they wanted to see in their own departments. I love qualitative responses because I feel like it tells the story of wellness from the first responder perspective. And it offers that insight and ideas that you don't necessarily get from those purely quantitative ranking of the issues that they were facing. And it's going to really help drive us in our action planning with the FirstNet Health and Wellness Program of where we're going to go as an organization. So before beginning this process, we knew there was a problem. We knew we wanted to do something about it. We have evidence it's important to our communities. We know that first responders have perceptions of their health and wellness needs. And all this data and information was really driving our team towards a systematic approach for addressing first responder health and wellness. So from the literature, we know that in order to integrate responder, community, industry, and academic capabilities to support the health, wellness, and readiness of American first responders, we would need an evidence-based framework to do that. And it was going to have to serve as a governance structure for how we manage this, because we're a large organization, and there's many very large organizations that support public safety and their specific professional members. And we at the FirstNet Health and Wellness Program utilize community coalition action theory as that framework in which to adopt and facilitate change across these multidisciplinary organizations. So what does that mean? Dr. Francis Butterfoss's community coalition action theory has been used in many successful coalitions, including the Army's Community Health Promotion Councils, the CDC's Violence and Injury Prevention Program, and cancer prevention plans, the Action Alliance for Asthma, and others. With the FirstNet Health and Wellness Program, we've adopted Dr. Butterfoss's work to integrate the public health process with community coalition action theory to stand up the FirstNet Health and Wellness Coalition. And that's really going back, if you think back to our strategic goals, objectives, and mission statement was to bring that integration to the table. And this is how we knew we were going to be able to do that. So the first step in addressing the health and wellness of a specific population is to establish that governance framework. That's the how you're going to do it. It implements a specific system to address the risk factors in a holistic fashion that we just discussed. Consequently, AT&T established the First Responder Health and Wellness Coalition to lead this effort. So characteristics of high-functioning coalitions include a senior leader that functions as a champion with the ability to mobilize resources to address priorities identified by the coalition. In our case at FirstNet, built by AT&T, our president of FirstNet and public sector, Mr. Jason Porter, is leading the coalition effort and serving as that champion. In addition, high-functioning coalitions have engaged stakeholders, a formal membership. I'm going to share that with you in just a minute. They have formalized roles, responsibilities, and procedures. We've published the FirstNet Health and Wellness Charter as a function of establishing that formal roles and responsibilities. We have a dedicated facilitator, which is myself, and we are implementing plans to address these specific priorities that we've been bringing in from the literature and our needs assessment process. Coalitions are an evidence-based approach for strategically planning on ways to address a population's health and wellness needs across an organization and across multidisciplinary systems. You can do them on the very small level, at departmental level. You can do them at a community level, and you can do them at an organizational, and also across different public and private organizations out there. This is really positioning us and our strategic plan to be successful because it allows us to engage in disparate organizations and bring them to the table. And one of the things that was successful, well, it's very important to us at FirstNet, was to be responsive to the needs of our first responders over the long haul, not just for the short term. So the structure of the coalition, I alluded to this a little bit earlier, but just to give you a little bit, I'm starting to dive into the sausage making of our process and our coalition. That integrated commitment across AT&T leadership. We've brought all of our public safety organizations to the table. There's about 20 to 25. I'll show you those in a minute. And they represent a cross-section of all the disciplines. And so including law enforcement, but also fire, EMS, frontline nursing and doctors, public safety communications, dispatch, telecommunications officials. And so this process is letting us identify priorities. We wanted them to be holistic across mental, physical, social, spiritual, and environmental domains of wellness. We wanted to have their input so that our partners were helping to drive what we were doing. And then we wanted to allocate resources. So for AT&T, that meant funding, partnerships, agreements, and also some of that capital, influence capital that we have so that we could really be driving towards an impact through policy, programs, and innovation. And I do want to highlight innovation because AT&T is a technological company. And so we're also looking at those very forward-thinking innovations that are coming out in support of law enforcement, safety, and wellness. Now, this next slide is going to show you the membership of the executive board and the full health and wellness coalition. I know that's a lot of alphabet soup that you see on the slide here, but what I want to share with you is our executive board is each of the disciplines is represented by a leader from their field. So we have a chief of police representing police chiefs. We have a sheriff and corrections leadership, law enforcement officers from the boots on the ground, police officer that serves on the executive board. Same thing with fire chiefs, clinical psychology, emergency management, communications, firefighters, and again, EMTs and EM chiefs. When you look at the full coalition membership, just to give you the scope of who we brought to the table, we have nonprofits, the All Clear Foundation that supports first responders. We have AT&T's Corporate Social Responsibility. We have the First Responder Network Authority, Global Medical Response, the International Association of Fire Chiefs and the International Association of Firefighters. The International Association of the Chiefs of Police sits at the table. The Major City Chiefs Association, the Major City Sheriffs Association, the Major Fire Chiefs Association, the National Association of Police Officers. We have Noble at the table, and many others, the National Sheriff's Association. So as you can see here, we really truly brought together the leadership across public safety organizations to work together on this issue and ensure that, you know, one of the things, if you hear individuals talk about FirstNet, FirstNet was built for first responders by first responders. And it was important for AT&T and the FirstNet program that we were also building our health and wellness strategy with first responders by first responders, because we wanted them to engage in it. And we wanted to make sure we were doing the right thing and engaging in the right ways, supporting their existing efforts, as well as looking at ways we can develop new ones. So once we pulled together all the key stakeholders of the coalition, assessing the evidence that I just presented with you, the next step was really developing those goals and objectives for the First Responder Health and Wellness Program. And I want to share with you next what that roadmap looks like today. So the First Responder Health and Wellness Coalition Roadmap to Wellness creates that collaborative framework through the coalition process I just described. It allows that membership to enable, assess, and analyze evidence-based assessments to drive data-driven decision-making. I really, really wanted to make sure that we were rooted in the evidence in how we were developing our strategy from the ground up. Third, it allowed the coalition to prioritize efforts with AT&T for the most critical priorities. And really where the conversation is now is peeling the onion on that needs assessment results so that we're bringing in the perspective of the first responders into what we're doing. This way, we're engaging with our customer base on what we're doing and not just throwing solutions and hoping that they stick. We also wanted to use our existing infrastructure to identify resources and applications that support first responder health and wellness. So we have capabilities internal to AT&T. I mentioned that we're a technology company. So part of FirstNet is an app ecosystem that curates and assesses applications that help public safety do their jobs. And so consequently, we're using that process to identify health and wellness applications that best serve the needs of first responders based on the data that I just presented to you. In addition, we have a really robust communications network. You saw from the data that people wanted increased awareness of the problems, they wanted increased awareness of what was out there to help them. And we have the capability to do that through our social media, our newsletters, our corporate voice. And so we're bringing that to the table to help support the efforts of the associations that we're working with and these top needs that we've identified. We lastly are fostering targeted interventions and strategies. Okay, so those targeted intervention strategies are really where we're going. I don't have a lot to speak about. I have some, I'll share some of them with you, but this is where we're developing those points of interaction with our first responders and law enforcement to support their health and wellness needs in conjunction with those associations. We wanted it to be very specific, very responsive, very adaptable and responsive. And we wanted to think about how public safety law enforcement deploys to a critical event and how is wellness integrated into that. So that's really where we're going. And I'm going to share a little bit more of that detail now in the next couple of slides. Okay, so this slide demonstrates a detailed logic model because I know you all are scientists and researchers in your own rights, and it's valuable to see the nuts and bolts of a program like this taking place. And it's also helping to make sure that we have a document for the coalition to look back on to make sure that we really are, all of our activities are moving towards those short, intermediate, and long-term outcomes that we're seeking. I remember when I first sat down with the president of FirstNet, he really did say, I want to save lives. I want to make a difference with this program. And so really that long-term objective to save lives, reduce suicide is one of our #1 priorities that we're trying to achieve. But before I get ahead of myself, we've taken our input through those key stakeholders that I mentioned and the corporate infrastructure to facilitate that collaboration, to develop these detailed plans, the messaging I mentioned, access to health and wellness information, the apps and the mHealth capabilities that exist in technology today, and how we assist in delivering those services to public safety. So in our near-term outcomes, we wanted to achieve 80% or more participation in the stakeholders in the coalition. And really we're doing that. People are so excited that we're participating in this field and engaging and supporting their own efforts. We want to identify 3 to 5 health and wellness priorities to focus our efforts on the next 2 to 3 years. And we're doing the consensus building towards that right now with our coalition. Again, increase awareness of first responder health risk factors via social media engagement. And we've achieved that as this engagement fluctuates between 1.8 and 2% through social media, being the benchmark being 1% engagement in all posts. In the next 6 months, we'll be focusing on detailed action planning engagement within external affairs, increasing our participation at the local level for first responder needs through trainings, programs, webinars, and outreach. And all of that is driving towards those long-term outcomes to save lives, reduce suicide, increase resilience, enhance physical, spiritual, mental wellness, and really establish us as a partner in responder wellness. So this logic model is driving the program towards targeted interventions that meet our customer needs, while also demonstrating our corporate values of being there for our customers. Hopefully by this point in the presentation, you've really seen how we're integrating and bringing all this and weaving the whole strategy from our corporate values up through bringing together and integrating across all of those associations, and again, driving towards those outcomes we're seeking to achieve. So I mentioned our current targeted interventions. The coalition is always going to stay at the top of our intervention strategy, just because that's how we communicate. We increase our social network integration. We allow cross-pollination across the different first responder communities. And it always makes sure that our priorities are being driven by the first responder needs so that we as an organization are being responsive to that. It'll be an enduring part of the framework for the long haul. It is, and what we know from the literature and what I know from my work with the United States Army is that coalitions and frameworks like this create stability. You're probably aware that law enforcement changes leadership on average every 2 years, very much like command leadership in the Army. And so having that network of partners at the table creates stability, even as leadership changes, so that, again, adaptable and flexible, just like law enforcement has to be when they run towards community needs at a moment's notice. So integrated messaging, we've talked about that already. We've started a health and wellness page on FirstNet.com. We have a newsletter called FirstNet Advisor that has a wellness circle that addresses those topics. We have a weekly sales team meetings called the FirstNet Open Mic, where we also make our sales teams aware of the needs and risk factors of the first responders that they are supporting. Our social media and podcasts are also helping to bring awareness to the issues facing law enforcement and also those activities that we're trying to do to address the issues. Now, deployed operations. This is, I would say, my bread and butter, something that I believe in. I believe you take health and wellness to where the people are at, where they live, work, play, do their jobs. And so I also believe that we need to walk the talk as FirstNet. So FirstNet will deploy mobile cellular towers. They're called SATCOLTs and COWs. It means they have a cellular network on top of those specific vehicles, and they will drive them into a wildfire so that cellular connectivity is maintained for public safety. In the event of a natural or man-made disaster, we also go to support public safety where they're responding. And I want our wellness program to also be doing that. So we've added a therapy dog to our program that will deploy to public safety in support of their mental and emotional recovery from these events. We are also looking at deployable wellness centers and how we integrate wellness into where we go in support of public safety operations. In our wellness app catalog, we have curated the Responder Relate peer-to-peer chat application that is peer-to-peer support, has been well documented as supporting first responders and law enforcement in helping to reduce the stigma of issues surrounding their mental, physical, spiritual needs, and gives them a safe and anonymous place to discuss that with their peers. The Lighthouse Health and Wellness application is another app that is curated resources specifically to address public safety needs in an app-based platform. We've recently brought on the Better app and the Better Stop Suicide app. And there are additional applications that we're curating to target each of those different priorities and needs that were identified by our needs assessment. And then the Wellness Roadshow. I talked about that a little bit. I jumped, I apologize. Wellness Roadshow, mobilize wellness, taking wellness to the population, identifying trainings that will deploy and support first responders in their local environment so that they're getting evidence-based, tailored to their specific needs and topics that they specifically want addressed as a part of their wellness needs. So finally, so in conclusion, FirstNet, built with AT&T, believes can best demonstrate that value statement that I started with by being there for the first responder community. One of the stories that I tell personally when I go to speak on this to different first responders is I'm a military spouse. I was diagnosed with cancer 4 years ago, and we were in the middle of a move when all of this was going down. My husband got orders from the Army moving us from Kansas to Washington, D.C. Now, the great part about Washington, D.C. is there are amazing oncologists there. My health is great. The story is not about being health, but it was about being in a difficult part. It was about having a health issue that I was facing and my family was facing. And we had bought a house sight unseen that we knew needed painting and updating, and while also juggling all of the healthcare that I was currently needing in this very unexpected move to DC. When we showed up at the house that we had purchased and saw it for the first time, there was a smell of fresh paint. So very dear military friends of mine had gotten the key to the house and painted it with the colors I had picked out. And it was done. So I could focus on my health and wellness needs. And that was being there for me in my time of need. And that story to me was really driving the vision, the mission of what we're trying to do at FirstNet. It's about showing up. It's about being there. It's about helping to support the infrastructure with these relationships that we're building across FirstNet so that, if you're going through a crisis, somebody shows up to paint your house, if you will. Not that we're necessarily going to show up to paint your house, but that's the feeling and the spirit that is nested in what we're trying to build in this program. And really, we want to make sure that everything, that creativity, that feeling, that emotion, the innovation that we're driving, the initiatives that we're currently developing is driving towards that ready, resilient law enforcement officer able to support public safety at a moment's notice. So with that, I want to thank you for your attention. That was a lot of information in 45 minutes, but I wanted to take the last 5 minutes to address any specific questions you have. So Dee, I don't know if there's any questions or if anybody wants to raise their hand, I will take them at this time.